I'm an autistic woman. Of course I did get diagnosed with autism into my 30s. I'm an autistic woman. Of course everyone says I'm lying when I tell them that I am autistic. I'm an autistic woman. Of course my kids are autistic.
Peace Patrol here, and we have to stop trolling people who have been diagnosed with autism. So let's talk about how to diagnose autism in children. So as you're aware, autism is on a spectrum. This means that you'll have kids who are doing quite well in school, are really strong in math, arts, and sciences, and music, and you will never really know unless you ask them. Some children have moderate impairment, which means that they may have some struggles in school, building social relationships, and need some support from their family or school teachers. And some kids have severe impairment, which means that they cannot do their activities of daily living. They may have some behavioral issues, and if they have genetic disorders, they may have some comorbidities like seizures or epilepsy or cerebral palsy, for example. Regardless of where you are on the spectrum, you need to have a couple of diagnostic criteria to be met to be labeled autistic, and there's two in particular. So the DSM-5 categorizes two criteria. The first criteria is impairment in social communication. So this may look like having challenges with initiating social interaction, or maybe not having the similar interests with other people. There's also nonverbal cues as well. So for example, eye contact, not having sustained eye contact and meaningful eye contact. You may be using a lot of gesturing, a lot of pointing, and kids in particular, especially toddlers and infants, may be using a parent to get objects and finger pointing a lot. And finally, impairment in maintaining social relationships is also key. So for kids, it may be difficulty with imaginative play with their other peers, and for adults, it may look like not having sustainable relationships. The other criteria for autism that is required by the DSM-5 is repetitive and restrictive movements or interests. So that could look like repetitive words, phrases, grunting, or copying of movements that you see quite often with other people or something that you may see on television. Restricted movements can also be resistant to change, believing in something and thinking that you cannot change it and there's no way to adjust. That adaptability is restricted. You may also be focused in a lot of specific topics, so you may see a lot of kids who really like dinosaurs, who line up dinosaurs in a row, or who may know more about math and science and galaxies, something that they haven't really learned in school. That might be something of a concern as well. They may also have challenges with sensation and texture, so they may like mushy food, they may like popping bubbles, they may like flicking things, so fixated interests as well. If you meet those two criteria in whatever capacity, you may be labeled as autistic. For children, there are a lot of different testing that can be done, such as the ADOS, that can help diagnostically give you a confirmation as well. So you may say to yourself, well, doesn't my child have autism? Well, it really depends. If you call yourself an introvert, you may not really be an autistic person. Maybe you have social phobia or specific phobia. That in itself has a different treatment and different management. You may also say, hey doc, well, I have some challenges maintaining relationships, but you really have to be introspective and find out why that may be the case. If you have anxiety, depression, or mental health conditions like schizophrenia, those may be more reasons concerning for their own conditions and not really having autism. Sometimes autism can look like ADHD. It can also look like tics. It can also look like obsessive compulsive disorder. It may also look like a borderline personality disorder. That's why it's really, really key to have your family doctor or pediatrician or developmentalist see and assess you or your child for autism. I get a lot of patients and families who want the autism diagnosis more for a label, and there could be a couple of reasons. One could be from a school support section to provide the student with the best learning capabilities as possible. Some parents just really want an answer why their child may be different. And unfortunately, we sometimes get families who want it for funding purposes. Unlike learning disabilities, unlike ADHD, unlike mental health conditions, autism does have some money behind it. You can get funding for many things such as behavioral therapy or medication or occupational therapy or physical therapy. All of that is inaccessible if you have something else aside from autism. So sometimes it may take your family doctor, pediatrician, or developmentalist multiple assessments to really figure out if a child truly is autistic or not. Sometimes a hearing delay or difficulty seeing can easily mislead somebody to diagnose somebody with autism incorrectly. So work with your family doctor, work with your pediatrician or developmentalist, and see if you truly have the signs and symptoms of autism. It is important to have that diagnosis, not just from a label perspective, but also to have a pathway and guidance towards the rest of your life.